My name is Clara McChesney, registered nurse, and today I will be talking about safety on the job, the effects of the physical demands in healthcare, specifically talking about back pain and the contributions and causes of back pain in healthcare workers, and talk about one solution to reduce the amount of back pain. In the healthcare field, we are exposed to many different hazards, such as ergonomic hazards, musculoskeletal disorders, and other work-related injuries. A staggering 66.6% of healthcare workers between the ages of 30 and 49 have reported incidences of low back pain. That percentage is quite high, but it's possible it could be higher because there could be healthcare workers out there that have not reported their low back pain or back pain in general. It is important to note in regards to back pain that sometimes when we're younger, we put a lot of strain or stress on our backs, and we might not have any effects of that until we're older. Some contributions to back pain in the healthcare industry are manual lifting, transferring between two horizontal surfaces, ambulating residents or patients, repositioning in better chairs, manipulating extremities, transporting patients, residents, or equipment, performing activities of daily living, stopping falls or transfers from the floor, and assisting in surgery. Reports of back pain incidences are higher in the healthcare workers than those who work in heavy industries. This is an interesting fact because when we think about heavy industries, we think about construction workers and hard manual labor. With healthcare workers, we think about taking care of other people. Who is the most susceptible group for back pain in the healthcare industry? This should come as no surprise that the nurse aides have the highest risk for back pain injuries. The CDC reported this back in 1987, and almost 40 years later, this fact is still true. Earlier, I gave a list of the contributions of back pain, but let's dive in a little deeper with the causes of back pain and some examples of each. So we will talk about forceful exertion, awkward position or posture, and repetition. Some examples of forceful exertion include lifting and or transferring heavy or large patients or residents, unexpected or sudden forced motion or movements, or trying to stop a patient or resident from falling or lifting them off the floor after a fall. As healthcare workers, we are educated not to try and stop a patient or resident from falling. Rather, we are supposed to allow them to fall against their body and let them slide down to the floor to help protect both from injury. But when you're in the situation, sometimes your first reaction is to try and push the resident or patient back up or hoist them back up to a standing position. Unfortunately, this can have consequences for our body and the resident or patient's body. Some examples of awkward position or postures with bending, twisting, or reaching include putting on gait belts and providing care in bed. This happens when we are bent over in an awkward posture and putting strain on our back trying to complete these tasks. Dressing or undressing patients or residents, repositioning or turning in better chairs, or doing any type of manual transfer. Some examples of repetition include repeated repositioning in bed and numerous transfers without taking a break. There are many solutions out there that could help reduce the amount of back pain incidences that are reported from healthcare workers. but one obvious and simple solution are mechanical lifts. Mechanical lifts or mechanical assist devices such as Hoyer lifts or sit-to-stand lifts, which are pictured below, reduce injury by avoiding those unnecessary manual transfers. They also help reduce awkward postures, reduce forceful exertions, and reduce the repetitive motions we find ourselves in. This technique may take longer to perform the task, but they protect staff and residents or patients from avoidable injury.